Hello everyone. This is Dr. Dinesh Chaudhary from Department of Neurosciences in Indraprastha Apollo Hospital, New Delhi. I'm here to discuss about a very important topic today, the Alzheimer's disease and dementia. Alzheimer's remains one of the most common cause of dementia. Around 60 to 80% of the dementias are Alzheimer's dementia. And why we need to know more about it is because it's often underdiagnosed. And if you are aware about the situation, the treatment can help the patients recover better. So, what exactly happens when you develop Alzheimer's dementia? There are two molecular changes that happen in the brain when you develop Alzheimer's. One is formation of plaques inside the brain parenchyma. Also, there are neurofibrillary tangles that get accumulated as you age forward. And also, the insult of the Alzheimer's disease adds on to it. That leads to global cognitive decline that makes the person slower and makes them more forgetful, as well as eventually patients tend to have difficulty in conducting their daily routine activities. So, what are the symptoms that one should be looking for while dealing with dementia or Alzheimer's? The earliest would be very subtle memory loss or getting lost in very familiar situations, like forgetting addresses to the house, getting back from a crowded place to your home could become a difficult thing. And along with that, there's often disorientation. Behavioral changes are often one of the commonest presentation of Alzheimer's disease. So once we know what Alzheimer's can present with, we need to know how can we actually catch it early. With recent developments, we have got molecular biomarkers for early detection of Alzheimer's disease. Earlier, we used to have only clinical diagnosis, but clinical history may take around 20 years after the biomarkers to suggest that patient has got any Alzheimer's or any dementia going on. So, with the availability of amyloid beta 40, 42, their ratio, and very good biomarkers, one can try and look into the possibility of Alzheimer's much earlier than the clinical symptoms themselves, predating almost 2 decades to the onset of symptoms. And that is going to become a very good screening test in coming few years. Along with that, there's a dual tracer PET MRI for patients who need to be diagnosed with Alzheimer's or other kinds of dementias. And why do we need to diagnose the patients early? Because there are newer treatment options coming up. Unfortunately, till last decade, there were no curative treatments for Alzheimer's. But as we move into the new decade, there are different possible options for treatment. Some antibodies are coming into picture, something like lecanemab, which can be given to reverse the disease process. And it's very exciting for patients who are looking for the cure for Alzheimer's. And we might have answers for that in next few years. So let's all get together and spread more awareness about the disease. It's very important that we catch the disease early, try and recognize the symptoms, support the patients who are suffering from Alzheimer's and related dementias. And we need to form a lot of dementia care groups or dementia survivor patients groups wherein they discuss their daily routine activities as well as the challenges they face, so that you form a good peer group of patients with dementia that can help them get together into a phase where they can deal with the challenges that Alzheimer's and dementia would throw at them every single day. So let's all get together in this campaign to spread more awareness about dementia. Thank you.